Occupational therapists can be found serving people with a number of physical disabilities, including burns, amputations, congenital abnormalities, physical dysfunction of the elderly, blind and deafness, spinal cord injuries, and chronic physical handicaps. Therapists in this setting need to be skilled in teaching activities of daily living, work simplification, and training in the use of upper extremity prostheses. Many may argue that the work of an occupational therapist in working with the physically handicapped individual is relatively simplistic, given the ability to identify which movements are normal or not, and to develop treatment plans to best correct the impairments. However, it must be understood that this process is far more complex than one may assume. Let us take, for example, the use of the upper extremity, often the focus of treatment in a physical disability setting. Since the upper extremity is fitted to perform many daily activities, the motions that an individual must use for one activity may not require all of the movements available. Thus, a detailed and precise analysis of specific movement patterns available for all activities must be carefully studied for each treatment plan. Although one may only initially see an individual using his arm to eat, occupational therapists understand that there is a dynamic interaction of muscles, joints, and coordinated movement patterns integrating to perform this activity. Beyond this understanding, the occupational therapist in a physical dysfunction setting must have a thorough understanding of mechanical requirements, materials, and fabrication processes. Given the passing of Medicare and Medicaid, occupational therapists are now seeing an influx of patients seeking services, therefore bringing a greater opportunity to strengthen this area of specialty. The recent deinstitutionalization and comprehensive mental health center movements were two major victories for occupational therapy and the treatment of the mentally ill. Most predominantly, we have been working with major mental illnesses including psychosis, schizophrenia, and major depression. An exciting new area of specialization has emerged in now being able to treat clients within their own communities. In addition, our use of workshops and psychosocial group treatments have increased, focusing on skills such as functional living and drug management. We still, however, recognize the purpose and importance of crafts, as well as normal living experiences. Looking forward, we hope to follow Gail Fiddler's vision of incorporating activity or task-oriented groups led by occupational therapists as a complement to the traditional psychotherapy group. Ideally, this will provide clients with a greater opportunity to practice these skills and adjust back into their communities.
Working with young children with physical disabilities, an occupational therapist has the opportunity to bring the greatest hope of finding independence in their daily lives. Children that are typically seen in an occupational therapy pediatric setting vary in regards to their diagnosis, including developmental delays, post-polio syndrome, and cerebral palsy. Just as with the treatment of adults, children too must be given the opportunity to engage in normal day-to-day practices, such as dressing, eating, and play. In addition to these standard areas of practice, a recent trend has begun to introduce new specialty approaches occupational therapists can incorporate into their practice methods. Such specialties include reflex development, neurodevelopmental treatment, otherwise known as NDT, and sensory integration and a sensory motor lens. Occupational therapists can determine the method that will most greatly benefit the child in treatment through clinical observations, and using a wide range of therapeutic activities, this treatment can focus on developing the skills needed for children to advance throughout their lives. In some cases, however, additional resources must be utilized during treatment. With the guidance of an occupational therapist, children can learn to use adapted devices to assist them in completing these tasks that may otherwise not be possible given their physical handicap. The ability to incorporate the functional use of these devices may not always be as easy as one would hope. However, with kindness, patience, and compassion, an occupational therapist can work closely with children to learn the skills necessary to complete these tasks. And we must not forget that all children benefit greatly from the participation in play. Therefore, occupational therapists must always find a way to incorporate this fundamental aspect of the children's daily lives into their treatment sessions. Both medicine and the government are realizing something which occupational therapists have long since known. It is the individual that counts, not only his personal problems, his physical and mental states, his pocketbook, his hopes, his fears, his loves, but just his being and existing in a society and having a place in the sun.